Hi, guys. Welcome back to Those Little Pediatricians. I'm Dr. Aniksha,
And I'm Dr. Deshna.
and this is the podcast where we talk about all things related to children's health in relatable bite sized pieces. So, today is a really great episode, an episode we both love to talk about. We're going to talk about developmental milestones today.
I'm very excited about this one. I think, especially for first time parents, we get so many questions about development like, oh, what comes next? Why are they doing this? Is this normal? So we hope this will be helpful for you guys to refer back to as you watch your baby grow.
Yeah, I love when babies come in for their well child visits and then they look so different every time I see them. And I tell the parents, I'm like, next time they come, they're going to look like totally different kids. And they bring them in and they have personality and they're running around and they're trying to roll off the table. It's so fun.
Yeah, the well childs are one of my favorites too for that very reason. And also giving good anticipatory guidance about what to expect because babies do a lot of things developmentally that look really weird sometimes. And a lot of it is just reassurance that it is normal. So we'll talk about it.
Okay, first we'll talk about how the brain develops in babies because this is kind of important as to in terms of nutrition, but also how things might change over time. So, you obviously have a lot of nerves in your brain, and there is a process called myelination in which your nerve fibers are wrapped with this fatty sheath. And what that does is help the impulses across the nerves jump even faster to help things coordinate throughout your brain and send the electrical impulse throughout your brain even faster. And so this is really important for brain maturation because of that coordination. And in the first couple of years, this happens at a really fast rate. And this is what allows for cognitive, motor development, the things that we ask about in the well child visits. And this is also why I love to say that a chunky baby is a healthy baby, because I think one of our NICU doctors talked about this a lot in residency too, that like a lot of good fat in your diet, especially as a baby, all the fat that we get from breast milk or formula is so, so important for brain development. So there is no such thing as like a too fat baby. It is all good for brain development. So all those rolls and chunks are so helpful for them.
Yeah, and I think another to add to the diet aspect, it's also a reason why after 1 years of age, up until 2 years of age, we still recommend whole milk because it has all those fats that are really important to myelinate all those nerve fibers that are growing so rapidly. So if your pediatrician tells you about whole milk until 2 years of age, that's why.
All right, but with that said, maybe we can go through all like the different like groups of milestones and what to expect in different chunks of time.
Yeah, that sounds good. And I think a caveat, the point of this episode is not to just list out every single developmental milestone because one, that would take forever, but two, that's not as helpful because you could probably look that up on your own, like the exact specific stage and all, listing out all of the gross motor, fine motor stuff, but it's more so to give you a general view frame of why your baby does what it does at each stage of their life and their growth period. So let's start at, about birth through 3 months of age. So up until 3 months of age, the brain is still pretty immature. It is myelinating all the nerve fibers and it's building all those circuits needed for connection and survival. So the point of this developmental stage is really refining all those vision and hearing pathways. And babies are practicing filtering any meaningful sounds or stimulation coming from their outside environment, from their background noise, any new faces that are introduced. They're not so much recognizing those, but they're learning to filter out any sound, movement, faces coming through. So you'll see even as early as the first 6-ish weeks of life, they'll start to track your finger or any object if you move it. They'll start making eye contact gradually, and then they'll start smiling or have that social smile and cooing. And they also start to turn to voices and they begin to recognize caregivers as they develop the visual cortex part of their brain and also as they refine their hearing. Another thing is because the brain is so immature at birth, their movements are really jerky. So you see that startle reflex that happens, or you'll see your pediatrician check their toe and kind of run their finger up their toe. That's checking for the Babinski reflex, which is just a sign of their brain being a little more underdeveloped or still myelinating. Those will generally start to dissipate, and then their head control also slowly improves. So I think the takeaway is one, in the early months, it's all about your brain learning what's important and filtering a very stimulated world, and also refining their vision cortex and also learning how to hear or turn to various sounds. A fun fact is that at birth, a baby's vision is about as far as 8 to 12 inches away. So they can't really see much. So they are not able to see very well. And I would say reasons to check in with your pediatrician is when you see no eye contact by 2 months of age, that is a red flag. Or if they're either very floppy or very stiff. So either or. A good example of this is when you lift a baby up by their arms, they should not be slipping through your arms. Their arms should be well supported by your hands.
Sorry, Aster is like being he's like right here. Sir, can you go to your bed, please? He's like tip-tapping and like sniffing. Aster, do you want to talk about
Oh,
months 4 through 6? Okay, go back. Okay, let's talk about months 4 through 6 next. These are some of my favorite months because I feel like this is where the personality comes out. They don't have stranger anxiety yet. So it's like such a fun time. They have head control. So the key brain story here is that what you're trying to do is integrate sensory input with movement, and babies are now starting to make coordinated actions. Keyword is starting. They're continuing to learn how to make coordinated actions, but this is where they start to put things together. And so things that you'll notice is they'll start to roll, they'll start to laugh, they're kind of reaching and grabbing for everything. They start to maybe make some babbling noises, although this happens a little bit later on more clearly. And they'll start to recognize familiar people. So again, they recognize like parents and people who are around a lot, but they don't quite have stranger anxiety yet, which is still pretty cool. So typically you'll see they'll roll back to front and then front to back. That's because you see there's different amounts of muscle required to kind of do both of those things. And then, like Deshna said, they're already tracking and looking around. And so now they're kind of putting that together with reaching for toys or objects. So I feel like this is a really good time for you to have really colorful toys, toys of different shapes or textures, because they'll start to see a little bit more and a little bit more in colors on. And times to check in with your pediatrician are if they're not reaching for objects. So we're worried about like motor, vision, all that kind of stuff. Or if they're not really like laughing or having any sort of social smile or engaging, because these are things we'd expect to see by this time period. Also, around this time period, they're going to start having more head control. So, towards the end, that's when you're going to feel more comfortable about starting solids. And so, signs of starting solids will be like when you put a spoon in their mouth, they don't spit it back out. That's one of the reflexes. They can actually sit up in a chair and have their head controlled without you helping them. And if you're sitting at the table with food and they're like, you'll notice them looking around and being like, ooh, that looks good. Let me have some of whatever you're having. So, those are some of the things that you might see.
yeah, definitely more personality is starting to develop. And again, their brains are so plastic, again, still myelinating. So any like as much sensory input, visual input you can give to your baby. So I mean, we'll talk about this later, but at this age, reading, talking to them, anything really makes a difference, because next up will be like slowly developing speech. So on that note, 7 to 12 months. I want to make a side note. An easy way to think about this, because I recently talked about this with a parent. They asked, why does development occur in this pattern? It's because when you think about how the baby's brain develops, it's bottom up and then back to front. So it kind of that happens in that sequential order. So the back of the brain is where the visual cortex is. So that's often the first to develop. And then it kind of expands forward. That's kind of more towards the motor cortex, which is often the last stuff to kind of mature and develop in a stepwise fashion. And similar with bottom up. So the auditory cortex is closer to the bottom, and then you kind of go up from there. So you generally learn more mobility, memory, language, and you're starting to slowly problem solve. And that's just by development of your frontal cortex, your motor cortex, all of that. So how you will experience it as a parent is you'll see them start to sit up on their own without any support. They'll start to cruise or crawl. They'll generally from there start pulling to stand and even taking some first steps. There is also something called object permanence, which develops during this time. So when you hide an object, they'll start to look for it. Whereas prior to this, if you hid an object, they would act as if it never existed. So and then they start learning how to play peekaboo. They'll start waving, pointing, And then stranger anxiety also is a thing. Did we already talk about stranger anxiety before?
We kinda mentioned it, how it
Whenever,
doesn't
yeah,
exist
it
kind of
exists.
before
It
9 months, so it's not
matures for
existent.
sure.
When we pediatricians have, like, that 6-month visit, they're like, "Ooh, pediatrician, I'm down." They come, "No, who are you? Absolutely
Mhm.
not, go away." I'm like, "Is that because of the vaccines we just gave or because of the strain?"
So, anyways, times to check in at this age range is if you notice no babbling at all and if they're not weight bearing. Another thing is because their motor cortex is developing rapidly. Sorry, if they're having like one-handedness. So if they're preferring one side over the other, that's definitely abnormal.
Right. Let's talk about now we're kind of getting into like the chunks of more development. So let's talk about 12 to 24 months. So this is more defined by more like independence and exploration. Like Deshna said, because we're going bottom to top, back to front, we're starting to get like a hint of executive functioning skills. But again, those don't really fully start to take form until maybe like 5 or 6 or so, because that's when they go to
Mhm.
school. But anyway, so the way that parents experience this is that they're walking, they're climbing on things, they're climbing upstairs, they're running. So there's even more need to childproof the house if you've got stairs or things like that. We had stairs in our house, so my dad had to kind of like carpet them, deal with all of that. And now that we're older, he took the carpet out because he didn't like how it looked. During these times, there's a lot of like tumbling and falling that happens. And that is very normal, kind of like your jerky movements when you're a newborn. These kids are learning how to walk and kind of use their feet and all that stuff. So they are going to fall pretty frequently. And that's relatively normal. If there's other things that are happening, you can always talk to your pediatrician about that. There's also things like fine motor skills. So we generally have been talking about gross motor, which means just using your hands, using your feet, being able to crawl and walk. But this is more stuff like they're going to start stacking blocks. They're going to take like an etch a sketch, which I think has come back around again, or a piece of paper and a marker, and they're going to start scribbling, which is really great. And then they're going to start feeding themselves. So you'll notice they'll do this pincer grasp where they just use their index finger and their thumb to kind of like reach for objects, and they kind of use all their fingers and learn how to feed themselves with their fingers, with their spoon, and so on and so forth. And then this is also the time where a lot of parents are like, whoa, this kid's getting really chatty because their vocabulary
Mhm.
explodes between 12 and 24 months, where they go from mama dada to using all sorts of different words. And closer to 24 months, they'll even start to be using even more words. And we'll talk about kind of what 2 to 3 and 4 and beyond looks like. So, a lot more walking, a lot more fine motor skills, and a lot more talking, which is great. So, things that you want to look out for, or reasons to check in with your pediatrician, would be if they're not having any words and if they haven't taken their first steps by like 15 or 18 months. So, a lot of these milestones are a buffer. So, if your kid's not walking by 12 months, that's okay. But if it's not happening about 3 months later by their next check in, then that might be something we need to intervene on. And then the other thing to look out for would be any regression or loss of skills, like verbal skills. So if you'll notice, if you've had kids before around the 18-month and 24-month mark, we give you an MChat, which is an autism screening tool. And so if you notice that certain things aren't developing or certain things were developing but have stopped or have even gone backwards, this is a tool that we use to kind of start looking out for those things.
All right, let's go on to 2 to 3 years, so around the toddler age. At this point, the social brain is blossoming. They're learning emotional regulation and they're kind of refining their language. So at this point, generally, they're saying two-word sentences like, what's that? Or give me. And then same with 3 years, it's like three-word sentences, and then it just kind of accelerates from there. And then in terms of motor things, you'll experience jumping, climbing, pretend play. I kind of already mentioned putting phrases together in clear speech, but they have way more emotions and they're learning how to regulate them or not sometimes, which is when kind of discipline comes in.
I'm still learning how to regulate my emotions.
Yeah,
So
so, I mean, we give
honestly,
them a pass, honestly. And when to check in at this age is when they're not combining words, their speech sounds unclear or unintelligible to the family, or if they're having limited player interaction with other children besides their siblings. So those are definitely things to bring up for a more thorough developmental evaluation.
okay, let's talk about 4 to 6 years of age. So we're kind of continuing along the thinking train. So this is a little bit more higher order thinking. So a lot more planning, learning to problem solve, empathy, emotional control. And so if you think about why we start school around this age, is because they're developing these skills to not only be successful as an individual in school, but also be working alongside others and getting along with others in school as well, with people who are not their family or their siblings and what have you. So, how parents experience it is more complex gross motor skills. So, things like hopping on one foot. So, when they're 4, they can hop on one foot for a couple seconds. Then, as they're 5 and 6, they can hop for even longer. And then they'll start to skip as well. And then they know some colors, some shapes, some letters. They might be able to say the letters in their name, which is really cool. They're going to ask a lot of why questions. Like Deshna mentioned, this started earlier, but even more so now, it's like, why? Because this, why? Because that. And then things like getting ready for school. So, can they take turns? Can they build some friendships? Are they starting to understand empathy and fairness? They're starting to dress and undress themselves. So, those are really important skills for them as they get into this age group. Things to check in about would be if they still have hard to understand speech. So this would be things like enunciation or vocabulary issues. These would be reasons to check in. If they have any sort of rigid social behaviors. And I think a caveat to this is that there is a wide variety, right? So if you have a kid who's always been speaking at home, then they go to school and they're not speaking, and that's their rigid social behavior, that's more things like what we call selective mutism, where they're in a new environment, or if they have separation anxiety from a caregiver because they've been at home with a parent and now all of a sudden they're being separated. These are kind of normal things that we expect that can be, we can use a lot of different strategies to help them through. But if there are more rigid social behaviors where they really can't even do parallel play, they can't take turns, or other things that have kind of been signaling at home, but you're noticing even more now at school, those are things even more so to check in with your pediatrician about. But these are all things that can be tackled with a variety of different strategies and help from the school district and whatever else. But that's kind of like a really exciting time where kids are like brutally honest at the same time. So I kind of love like a 5-year-old who's just like giving it to you straight because they don't really have that filter, but they've learned so much that they like can't help but give you their advice. My fiance's niece, she's such like a firecracker. And anytime I'm like, wow, like that was so smart of you. She's like, what? Like it's hard? And I'm like, oh my God. Okay, Elle,
I've
just
been
really
humbled many a time by a 5 and 6-year-old.
yeah. But then when they give a compliment, you're like, "You really mean this."
So that's a general overview of all the developmental stages and things you can expect. So I think the big question we have with all of our parents is how can you as a parent support your child's development? And we can go into a little of the things you can do at home to best support your baby as they are developmentally like expanding so rapidly. So the first few things I'd like to talk about is really stimulating and developing the language part of your brain. So it doesn't really matter if they don't understand it. So, for example, if they're with you in the kitchen, sitting on their high chair while you're cooking, narrating what you're cooking, what you're going to do next, those kinds of things. Exaggerated intonation and doing it at a slower tempo is shown to really help them absorb and understand that a little better. Also, reading every night. There's a reason we say it at every single well child visit, reading every single night with that book out, with the pictures, with the words, helps a lot more in stimulation than any screen time will do. Number two, really setting up their environment with toys that allow for cruising, for reaching, setting up toys at various heights. I recently had a parent that brought their child in that was, maybe 11 months old who had not yet kind of taken first steps or not quite pulling to stand, and otherwise was developmentally normal. But one thing we talked about was, take their favorite toy and put it on alternating heights. So whether that's the couch or the top of a table or maybe a little bit more of an elevated surface, so they're compelled to kind of reach up or kind of try to pull to stand and get that toy. So setting up a playful environment can really help them develop their motor cortex. And to that point, encouraging movement and exploration is what I was kind of trying to get out. I can't stress this enough, limiting background noises, limiting screens. So prioritizing real and social interactions is super, super important. Everyone has access to an iPad, to a computer. So limiting that as much as you can, it's shown to be actually way more harmful.
And I think as two people who don't have children, we probably can't speak to how hard so many parents nowadays who are doing such a wonderful job of being like it's only on the weekend for like an hour
Mhm.
or like even,
Mhm.
and that is it's such a good setup because then you get teens who have minimal screen time too, and they
Mhm.
understand the importance of like outside time and physical activity and all those things. But it is so, so hard. But if you can set it up and, like, have that conversation as, like, with your partner about your child or whoever else is taking care of your child before they even come into the world, I think that, like, having a good media plan from the get-go is really just so, so important for their development.
It's kind of like how we talked about, if you've listened to our dietitian episode with Danielle and Jen, about how it all starts before you have kids. So setting that habit for yourself too. So if you're telling your kids like no screen time, but then you're like doom scrolling on TikTok, that also doesn't set a good example. So again,
Yeah.
easier said than done, but doing it as a family and setting that expectation before, I think, is more helpful.
Yeah, and understanding why kids love the screen so much because of those bright
Mhm.
colors, the
Mhm.
really playful sounds, so, like Desha mentioned, like, when you're reading a book, mimic those playful sounds and do it
Yep.
slower and more
Mhm.
exaggerated, and then, like, the color, right, making sure you have colorful toys. I feel like we see all these, like, really aesthetic, neutral colored toys, and the reality is those are very pretty to have in the house, but they don't help with that visual development
That's
that's really important. So kind of mimicking those colors and mimicking those sounds and that language in other ways is going to help you kind of replace what the screen is providing for that. We could go over the like general red flags again so you kind of know what to look out for and
yes.
when to check in. So
Yep.
I think Desha mentioned a lot of these early on, but things like if their movement or posture is asymmetric, so kind of like she said, if they're preferring one hand over the other and showing you that dominance before 18 months, that's concerning. So that's something to reach out to your pediatrician about. And then any abnormal tone or posture. So if they're too floppy, too stiff, or if they're really not achieving any of those key milestones, generally within that buffer of time, like we mentioned. If they have any reflexes that are persisting beyond when they should, this is one that you're not going to check at home. So this is something that we check because there are some that fade at a certain time. There are some that show up later and persist for life. So those are
Yes.
ones that we will always be checking for in our visits, and we will mention if there's anything abnormal. But again, you can always ask your pediatrician in those visits, were those reflexes normal? I'd like to know more about that. And we can
Mhm.
always talk to you more about that. And then if you notice like the quality of their milestones are different, so like if they're losing speech, if they're not gaining speech at the same rate they used to, or like the quality of their movements are different, or they're losing any quality of their movements, those are things to reach out to your pediatrician about. And then again, we always talk about that mom and dad intuition. If there's anything that just seems off and you're like, oh, I don't know, like this kid, like it's just not going at the rate I thought it was, or things aren't quite what they used to be. Or if you have an older kid in the house and you're like, oh, they're not quite developing at the rate that I expected from my first or second or third child or whatever it is, you can always reach out to your pediatrician about these things. We love talking about this stuff, and it's stuff that we always are constantly looking out for, even as they get older beyond age 6. So you can always reach out to your pediatrician really.
Yeah. And my only other thought to add is a lot of these guidelines that are strictly age based, I think parents get concerned when they are exactly 12 months old and they're not doing X, Y, and Z yet. We usually give a little bit of a let's just wait and watch, given they're developmentally otherwise passing all their milestones. We say let's just watch because each kid develops obviously differently. Usually we just do really close follow up, like, oh, let's see you in like a few weeks and see how things are going. Okay. So I hope this episode was helpful. We, again, like I mentioned before, we didn't really list out every single developmental milestone because that's very redundant, but really to give you kind of a brain map and to explain why your baby's brain develops the way it does. And so you have that information going into your baby's pediatrician appointment. With that, don't forget to rate our episode, rate our podcast, subscribe to us, and then we are active on Instagram. So give us a follow over there for more content. Okay,
All
we'll see you
right,
next time.
go read to your kid. Good night.
No screen time. Bye.
Bye.